Good morning, everybody. I'm Professor Antonino Araco, plastic surgeon from Milan. That's my presentation concerning high-intensity microfocus ultrasound for face and neck lifting. Now, in overview, microfocus ultrasound we need clinically for tissue contraction and tissue regeneration. Tissue contraction results on facelift lifting, and tissue regeneration results of better tissue quality. If you look at aging process, we get older and we lost volume and we replace it with a filler. Stoughton and also Rorick show with international paper the internal superficial and deep fat compartment is the place where we need to replace the volume. But when we talk about laxity and ptosis and pure skin quality to getting older, the HIFU, the microfocus high intensity ultrasound, have a good clinical indication. This is a paper by Lambros, and he showed the facial aging. He followed patients for many, many years, and he showed the difference in terms of skin laxity, poor mandibular definition, and nasolabial folds. When you get older, we increase this activity, and we see the difference. And when we get the anatomy, when we want to restore aging, we need to work not just on the skin, but we need to work on the underlying tissue, on the mass and the platysma on the neck. Now, we can do this, we can reach the mass and the platysma by the high intensity focus ultrasound. This is the technology that to focus the waves to the specific focal points, and we can focus the mass at 4.5 millimeters, the subdermal at 3 millimeters, and the deep dermis at 1.5 millimeters. And the research that go back from 2014, 2016, and we already see the clinical effectivity and the safety of the microfocus ultrasound. And the clinical indication is a very important point because HIFU are no indicator for everybody. So what we need to do is to choose the right patient, which is the right treatment for the right patient. Now we set up a scale called Araco ptosis scale, and we published this in 2020 in Aesthetic Surgery Journal. We divide patients in 5 groups, and groups 1 to 3 are indicated for microfocus ultrasound because we set nasolabial fold, cheek wrinkles, jaw lines, neck, indication or not for surgical neck lifting and face lifting. If we put all these together, we see these 5 groups of patients. Just to make an example, as a group 1, you see that absent nasolabial fold, absent cheek wrinkles, well-defined jaw lines, and no wrinkles on the neck. The 5 patient find in group 5, we see that the severe nasolabial fold, the cheek wrinkles, these are not really indicated for HIFU. Now, the clinical assessment we do with specific technology. This technology will make the 3-dimensional of the face and neck, and we report a very, very good image with the right position on the face and neck. Also, the red vectors, so we can measure this vector in order to see the difference and before and after. Also, another technology that sets the skin quality, also the wrinkles, and we can see and measure the wrinkles, in this case, the nasolabial fold before and after the treatment, and we measure the difference. Operative skill, what we do, we write down the area of treatment, we sign the area we don't have to treat because of the safety. In terms of technology, we pass through this motion technology in terms of delivering. It's the mechanical handle to deliver the microfocus ultrasound. Is very, very precise. You can see exactly where you are, and you can move slightly from down to down. And Also, they have a new technology, that's the technology with the fast motion. We can deliver the microfocus ultrasound by moving the machine. It's very, very precise. This is the personal experience, more than 1,000 patients since 2014. You see most of the patients between 35, 65 years old, 91% female, and most of the patients in groups 1, 2, and 3, 2 and 3. This is the paper that we published on Aesthetic Surgery Journal back in 2020, and for the prospective study of clinical efficacy and safety of a single session microfocus ultrasound. This is another paper the day after, and then we compared the microfocus ultrasound with calcium hydroxyapatite in terms of combined treatment for acne, moderate to severe. We see some clinical results. This from before and after neck and face. Neck and face, you see the good improvement in terms of jawline definition, nasal default, submental area. We consider this is only one session microfocus ultrasound delivered. This is another example, before and after. This is speed motion. This is another sample. You see also in men, the good definition, the lower mental area, also the jawline definition is like before, zygomatic area. This is again another example. With this, in terms of good definition, see profrenal mandibular line, nasal before, is quite good result. This is just one session of microfocus ultrasound. Also in this case, these are a really sagging skin and neck. Yeah, see the good results. Also for the higher orbital area, you see the lower lids, skin, neck. Also, you see this case, it was quite interesting because you see that before it was really indicated for the surgical facelift. She didn't want it, and we went with the first session of microfocus ultrasound. You see the before and after. It was quite a good result, impressive result, I have to say. But she said, okay, I'm happy, but I want some more. Some more, you see, the day after we went with another session of a microfocus ultrasound, but then you say that one more, and we end in a surgical facelift, and now she's quite happy. This holds you to say that we need to deliver microfocus ultrasound, obviously on the right patient, in indicated patient. I want to thank you, all of you, and see you next year.